For those of you that only watched the first minute of the video but want a quick summary, for non-surgical treatments of radicular pain caused by a lumbosacral disc herniation, this systematic review recommended manual therapy, exercise, and traction, despite there being low levels of evidence supporting those therapies. For a more invasive approach, they recommended an epidural injection, and that was actually based on a high level of evidence. Although for epidural injections, there's typically a stronger support by the evidence for short-term outcomes than there is for longer-term outcomes. If you want more information on all of this, keep watching. This systematic review specifically looked at non-surgical treatments for radicular pain caused by lumbosacral disc herniations. And to be included in this study, the lumbosacral disc herniation had to be verified on a CT or an MRI. And so there's not going to be that many studies that are going to be included for each of these treatments, just because in clinical practice we typically aren't able to verify every single case. We generally treat based on the actual symptoms that are coming in versus the actual structural pathology. And so keep that in mind as we kind of go through all of these treatment approaches, just because there's not going to be that much research supporting it. We need more that actually looks at this structural diagnosis. And this is reflected in the study because each treatment actually has two different categories. There's a level of evidence recommendation, which is specifically looking at the evidence supporting that treatment approach. They also did a strength of recommendation analysis, which looked at not only the level of evidence, but also the advantages and disadvantages of that therapy, the resources required to actually perform the therapy, and then also the acceptability and feasibility of that treatment approach. They broke up the treatments into three different categories. There was physical and behavioral therapy, medications, and interventional therapies. The only physical and behavioral therapy that was specifically not recommended in this systematic review was bed rest, and this was based on a low level of evidence and a weak strength of recommendation. And this is because bed rest hasn't been shown to be superior to remaining active. And this is actually very similar to the recommendations or in the clinical practice guidelines for low back pain, in that they all recommend trying to maintain activity while dealing with low back pain, or in this case, low back pain with radicular symptoms. The other therapy that was inconclusive for the physical and behavioral therapies was electrical therapy, and this was based on a very low level of evidence, and the strength of recommendation was obviously inconclusive because they weren't able to determine if these electrical therapies have any sort of effectiveness. Manual therapy was recommended despite there being very low level evidence supporting this treatment approach, and the strength of recommendation was weak. And this was because when they looked at the studies, there, first of all, weren't that many studies that specifically looked at manual therapy as a treatment approach with a verified disc herniation on CT or MRI. And so with the studies that were included, there just weren't that many patients involved. However, when they looked at one of the randomized controlled trials, they did see that active manipulation was more effective than a simulated manipulation, and therefore that's why they recommended manual therapy as a possible approach. The two therapies with the most evidence were traction and exercise, and this was based on a moderate level of evidence and a strong strength of recommendation. The problem with the exercise component is that it's a pretty general category, and the specifics on which exercises were more effective isn't known. However, exercise was a recommended treatment approach despite there not being a specific exercise program that we should do for those with radicular pain. For medications, the systematic review recommended NSAIDs, systemic steroids, and opioids for radicular pain. And this was all based on a low level of evidence and a weak strength of recommendation. The interesting thing that I saw with the NSAIDs category is that there were a couple of randomized controlled trials that found that NSAIDs were better than placebo for pain relief in the first 7 days. However, they also included a systematic review that showed that NSAIDs were not superior than a placebo. And so it's interesting that they still recommended using NSAIDs despite there being a conflict between the randomized controlled trials and the systematic review. For interventional treatments, the study recommends epidural injections, and this was actually based on a high level of evidence and a strong strength of recommendation. And That combination for epidural injections is actually the highest of any of the other treatments that were included in this systematic review. And what they found is that the clinical effects for the short term were strongly recommended by the literature, whereas the longer term effects were a little less so strongly recommended. There are a couple of approaches that these epidural injections can be administered. There can be a transforaminal approach, which is actually going to go through here, or an interlaminar approach, which is going to go through here. And while both approaches had research supporting their use, they actually found that a transforaminal approach was actually a little bit better than the interlaminar approach. So if we have a choice between the two, the transforaminal seems to have a little bit more evidence supporting that it's more effective. In summary, the systematic review recommends manual therapy, exercise, and traction for the treatment of radicular pain caused by a lumbosacral disc herniation, despite there being low levels of evidence supporting those treatment approaches. Unfortunately, we don't really know which exercises are more effective or which manual therapy techniques are more effective, and so future research should look to determine both of those. For a more invasive approach, they recommended an epidural injection, and this was based on a high level of evidence. They found that a transforaminal approach was a little bit better than an interlaminar approach. However, both approaches provided benefit. They also mentioned that while epidural injections typically provide short-term relief, this might allow us to transition for the long term into exercise and lifestyle changes.